COPE is one of just a few clinics worldwide, research clinics, that are dedicated to learning about the early phase of psychotic illness that's called the prodromal or clinical high risk, or even the attenuated phase of psychotic illness. Psychosis is a term that most people have heard about, but they may not use the term correctly. Psychosis is not a disease in and of itself. It's something that characterizes a lot of different conditions in psychiatry. For example, you can see psychotic states in things like serious depression, bipolar disorder, of course in schizophrenia, which is a very serious psychiatric condition. You can see it in certain medical disorders, delusional disorder. The word psychosis refers to a period of time. It can be less than a day, it can be years, where an individual loses contact with reality. And that can happen in a few different ways. One way that might happen is what we call thought disorder, where a person's ability to understand or communicate with other people clearly becomes confused, dense, derailed, difficult to understand. There can also be disorganized behavior, where a person is doing very peculiar things. For example, somebody is doing a behavior that seems to be illogical or repetitive in a peculiar way, or collecting things in a peculiar way. We can sometimes see what are called hallucinations, which is where somebody seems to be having a conversation with something that isn't there because they're hearing a voice or seeing something that isn't there. We can see delusions, which is where someone believes something very firmly that simply isn't true, like believing that people are talking about someone or want to hurt someone, or are putting ideas in their head or taking ideas out. We've learned from years of research at COPE that psychosis doesn't really begin abruptly in most people. There seems to be a period of months, sometimes years, where an individual gradually develops these symptoms, and when they first appear, they're softer, easier to miss, and are often detected not so much by the person but by the people around them, teachers, friends, co-workers, who then sometimes suggest to the individual that they maybe go talk to someone about these symptoms they're experiencing. At COPE, we've been researching this early phase of psychosis with the hope that maybe one day with research we might be able to prevent disorders like this. But right now, we're still in the phase of learning a lot about these conditions. We reach out to individuals in the community who might be experiencing symptoms like this, who might notice them in someone else. And we'd like to let you know that we offer research and clinical treatment here at COPE. Treatment is free of charge. Research is compensated. And research involves things like questionnaires, testing of a person's ability to think clearly, respond to questions, and we do what are called MRIs, which is where we do imaging of the brain to see if there are any changes there. Thank you very much, and if you know anyone who might be interested in learning more about COPE, please give me a call at 646-774-5232. And remember that if an individual doesn't meet criteria for our program, we can help locate more appropriate resources in the area. Thank you.